name is Lionel Louch. I'm a good Jamara, creator of Bugs Along Man. I'm going to perform a smoking ceremony, a cleansing for you this morning. The reason why we perform smoking ceremonies and cleansings is to ward off negative energies. When someone comes into my country to visit me, or comes to visit my family, we smoke them with the 3 plants from the country they're visiting or coming to. So the 3 plants, what it does when the smoke from these plants gets on the body, it lets the spirits of the land know who you are, it lets the fauna, the flora, and the children of the land, which are the indigenous people, know who they are, and they've been welcomed into that country. Now here on Boonwurrung country, we use 3 different plants. The first plant is the eucalypt. This is the manigum. This tree is a medicine tree, as well as a tool tree, and also a food tree. The sap from this tree is an edible sap, which we use as a natural sugar. The wood we use for artifacts, such as spears. And the leaves contain oils, which we use for medicine, for headaches, migraines. Today, for colds and flus, but we use it for headaches, migraines, depression, anxiety, and stress. This tree has a lot of uses. It represents community found right throughout Australia. You often see Auntie Caroline handing the leaves out to people who come and visit her. So the manigum. The next is the cherry balat. Amazing tool tree, food tree, and medicine tree. The medicine from this was used for snake bites, poisonous spider bites, as redback bites. So for any sort of poison insemination or bites by any animal, this is the plant we use for that. It is a fruit. It does produce a beautiful bush tucker. It's a stone fruit. But it's the only stone fruit that we know of in the world where the pip grows on the outside of the fruit instead of the middle. Fruit, high in antioxidants, vitamin C, really, really good for you. The wood from this tree is one of our best woods that we use down here for tool making. I use this wood for making spears, nullas, woomeras. This is traditionally we used here for the Perry shield and also the bull roarer. A piece of wood with a hole in it, with a string on it. This is the traditional wood we use for that down here. This tree, for the first year of its life, will connect its root system to another big tree. That big tree will help this tree survive to a certain age. When it gets big and strong enough, it can defend on its own and detach from that tree. That is why this tree represents our children. Our children need us today to survive to a certain age. When they get old enough, they can defend for themselves. The black wattle represents our elders. This tree has multiple uses, the same as the other trees. The bark on this tree is medicine bark. We use this bark, we make a cup of tea from it, we drink that medicinal tea. It's medicine for my stomach and for my mouth. For open wounds or ulcers in my body, this is the medicine we use for that. The sap on this tree is also an edible sap. We use it as a bubble gum, we can make a jelly from it. These leaves I use for fishing. If I go down to a creek system and find a nice still pond in a creek system, I'll crush these leaves up in the water. The juice from this leaf will go into the water. It'll deoxygenate the plant and the water. Doesn't hurt the fish go to sleep, they float to the top, and I can go in and catch whatever fish I want. This tree also contains 2 different varieties of witchetty grubs, the beetle larvae in the trunk and the moth larvae in the roots. Amazing tool trees. I use this wood. Half my artifacts are made from the wood of this tree. It has multiple uses. This is why this tree represents our elders and our grandparents. We put these 3 plants together on a fire. They will produce a medicine smoke, a pure white medicine smoke, which we use to get rid of negative energies, bad spirits, or bad bacteria. Thank you.
Good morning, everyone. My name is Diana Heggie, and I'm the Chair of the Board of Peninsula Health. It is my great pleasure to welcome you all to our 2020 Annual General Meeting and Community Forum. Thank you for joining us virtually this year. Due to the pandemic, we are unable to hold this event physically. Whilst I do miss seeing your faces and meeting you in person, it is terrific to have so many of you able to join us online today. You have just been watching a smoking ceremony which Lionel Louch performed for us, especially for the launch of our Reconciliation Action Plan in December. Lionel is a Gundamara Kiri Wurrong Bundjalung man living in his home country on the Mornington Peninsula, and he was happy for us to share this with you today. I would like to acknowledge Aboriginal and Torres Strait Islander people as the first peoples and traditional owners and custodians of this land. We pay our respects to the ancestors of this country, elders, knowledge holders, and leaders, past, present, and emerging. We extend that respect to all Aboriginal and Torres Strait Islander people. We at Peninsula Health acknowledge the local traditional owners, the Boonwurrung and the people of the Kulin Nation. I would also like to acknowledge representatives from Mornington Shire Council and Frankston City Council, representatives from our partners Monash University, Deakin University, La Trobe University, Chisholm Institute, and Homestead TAFE. My fellow board members, the CEO of Peninsula Health, Felicity Top, members of the executive team staff, volunteers and friends, members of the community who have joined us online today. At the conclusion of the official AGM proceedings, we will have a facilitated question and answer session, our community forum, which allows you to ask questions and provide feedback on our services. There will be more details on this in a few minutes. I would also like to advise everyone that this meeting is being recorded and will be made available afterwards to everyone via the Peninsula Health website, as well as via the intranet for all staff. We will start with the official AGM proceedings. The minutes from the 2019 Annual General Meeting have been approved and accepted prior to today's online meeting. I would like to advise you that Professor Ken Thompson completed his 3-year term last June, and I would like to thank him for his valuable contribution and the expertise he provided to Peninsula Health over that period. We welcomed one new board member in the last 12 months, and I would like to introduce him here today, Hamish Park, who joined the board on the 1st of July 2020. Hamish is a management consultant with extensive experience in corporate governance, probity, public policy, crisis management, and professional development. He has strong public sector experience, advising the Victorian government in ministerial portfolios, including mental health, aged care, and community services. Welcome to you, Hamish. I would also like to acknowledge our existing board members, Dr. Nathan Pinskier, Alison Smith, Rita Kincotta, Dr. Alison Dwyer, Karen Corrie, Kirsten Mander, and Sylvia Hadji-Antonio. I would like to thank the board members for their contributions over the last year, and I look forward to continuing to work with you for the benefit of our community. For the financial year ending the 30th of June 2020, Peninsula Health's operating revenue was $660,458,000. Our operating expenses were $672,906,000. This year has seen some difficult and challenging times experienced by all public health services in managing the ongoing challenges presented by the COVID-19 pandemic. Our target was to deliver a balanced budget, and with the challenges described, we have managed to deliver a deficit of $12,448,000. Our Executive Director of Finance, Rochelle Anstey, will have more detail on this in a moment. Our financial statements have received an unqualified audit report from the Victorian Auditor General and fully comply with the Victorian Government's financial management framework. You can review the full financial statements for the 2019-20 year in our annual report, which is available online through our website. The last year has been a truly extraordinary one. The reporting period for our annual report included both the Victorian bushfires and the first wave of COVID-19. As we look back on the 12 months since we last held our AGM, It is a chance to reflect on the full impact of the pandemic so far on our staff, on our volunteers, and on our community. The second half of 2020 was also extremely challenging, with increasing numbers of COVID positive patients requiring care and the Frankston Hospital and Golf Links Road outbreak. Throughout this, our staff persevered and continued to provide the best care for our community. Being with you here today gives me a chance to say how proud I am to be part of this great organisation. Together, we have navigated some truly difficult times in 2020 and have at all times endeavoured to maintain high standards of care and governance throughout. The fiscal challenges we faced were not insignificant, and our clinical teams have been extraordinary in responding to situations most had never previously faced or thought they would ever have to face. Many of our people have been assigned to roles they were unfamiliar with, and yet they have taken on these new challenges and excelled. Our non-clinical staff have also been amazing in providing vital support to those fighting the pandemic on the front line. Our staff work long hours in tiring and stressful conditions, often in full PPE gear, which is hard at the best of times. Don't mind about dealing with a highly infectious virus. On behalf of the board, I would like to acknowledge the tremendous efforts of all our staff here at Peninsula Health. Your efforts to keep the virus at bay while maintaining the commitment, professionalism and care you bring every hour of every day for our patients, clients and our local community did not go unnoticed. Thank you so much for your extraordinary work during a very difficult period. For the first time at Peninsula Health, we recognized our long-serving staff members online in a ceremony just before Christmas. I would like to share a snapshot of that ceremony with you now to recognize all those staff who have given 30 or more years of their professional lives to Peninsula Health. I would also like to acknowledge the executive team and Felicity Top, our CEO, who led the organisation magnificently through these uncharted waters. Finally, I would like to recognise the significant contribution of the more than 700 people who selflessly invest their time and expertise with us for the betterment of Peninsula Health and the local community. Our volunteers, auxiliaries and consumer representatives are core to our success as a health service, and I truly hope we can welcome you all back in some capacity at the appropriate and safe time in 2021. I would now like to welcome our Executive Director of Finance, Rochelle Anstey, to deliver the financial report.
Thank you, Diana. Good morning, everyone. For the 2019-20 financial year, Peninsula Health recorded a deficit of $12.448 billion, which in an extremely challenging year represents just 1.9% of our annual turnover. The COVID-19 pandemic was the key factor which contributed to this position, as the health service was faced with a number of unprecedented challenges, especially in the final quarter. The first wave of the pandemic forced us to make a number of decisions, first and foremost on our ability to keep our community and our staff safe, and on advice from the Department of Health and Human Services. We scaled and expedited our work from home program to ensure that all staff who were able to work from home had the technology which allowed them to do so. With a state of emergency being declared on 16th of March 2020, we were forced to defer elective surgery and reduce activity, which had a notable impact on the financial performance of the organisation. The COVID-19 testing program has also impacted our financial performance, as operational and staffing costs increased to accommodate this important and critical work for our community. We also incurred some additional staffing and operational costs in dealing with the Victorian bushfires, which engulfed large parts of the state at the start of 2020. Although we faced extra and unavoidable costs in the financial year, we also were able to introduce significant efficiencies by migrating to a single pay cycle in late 2019. This change was significant for the organisation, but also emblematic of our desire to innovate and continually look for better ways to run the finance, revenue and payroll services at Peninsula Health. We are expecting the second wave of the pandemic to have a substantial impact on the 2020-21 performance of the organisation, which we'll be finalising in the coming months. There is far more detail on Peninsula Health's financial position for the reporting period up to and including 30 June 2020 in the annual report, which is available online through our website.
Thank you, Rochelle. I'm delighted to be here with you all this morning. My name is Felicity Top and I'm the Chief Executive of Peninsula Health. I would like to first acknowledge past and present board members who are hopefully watching today in this new virtual world in which we're presenting our AGM to you all this morning. I would also like to acknowledge our staff and volunteers who have been absolutely fabulous over the past 12 months, and I plan to celebrate their achievements during what has been quite an extraordinary year. We are meeting today virtually, which makes it a little bit more difficult for everybody, but we have got a chat function within the system there, and I'm hoping that people will jot down questions that they would like to ask me at the end of the presentation. Without doubt, this has been the most extraordinary year, or 2020 has been the most extraordinary year in my professional life. It tested all of us, it tested you, our community, and it tested our staff and our volunteers. We had to endure firstly the Victorian bushfires, and it's kind of almost a distant memory, the bushfires, but they had a big impact on many people. Many of our staff had families that were affected by the bushfires. And the smoke, if you recall, was quite suffocating and quite difficult for many of our community members who had respiratory illnesses. The second half of 2020 really did challenge us here at Peninsula Health. And I'm so proud of the way our staff dealt with the pandemic and dealt in particular with the outbreaks that we had at Golf Links Road and at Frankston Hospital. Wave one of the pandemic did result in a number of patients on our Mornington Peninsula community requiring the need for our ICU. And then wave two presented us a different client group or different patient group from residential aged care facilities. Both waves presented different challenges to our staff, but across the service, our staff were amazing. They were able to care for different cohorts of patients. They shared responsibilities and roles. They looked after each other. They supported each other. And with the support of our community, we were able very quickly to turn around the outbreak that we had here at Frankston Hospital. So I'm so proud of all our staff, and I'm very grateful for all the support that I got and that our staff got from our community. A large percentage of our staff over the last 12 months, as many of you I'm sure, have had to work from home, and that's posed difficulties for them. But again, the staff have embraced these changes, and many of these changes we will probably continue with over many years to come. What I'd like to do is cross over to our staff through a pre-recorded video so you can hear from them directly on some of their experiences during 2020.
2020 has been such a challenging year, and probably the most challenging that I've had in my career. But what I'm most proud of is just how our team really came together and supported each other. We really, it was difficult to connect with others during COVID, and we were really there for each other and also for our patients and their families.
So the year 2020 was a year of transformation. I think about transforming the way we work, the way we talk to each other, and then finding the courage to make things happen. And it has been quite a challenging time, but at the end, we actually came together, and I feel we'll make a difference.
Dental is usually really fast-paced, but COVID ramped it up even further, with changes coming nearly daily. But the team took it on board, took it in their stride, and really used that PPE to protect themselves and the community. And during March to October, we still managed to see nearly 7,000 emergency patients. It was amazing to see the staff just turn up every day, work their guts out, and just keep turning up with a smile on their face.
Well, 2020 brought us a once-in-a-lifetime experience. It was a test of friendship, collegiality, and also to see how much we want to care for each other. I think we came out with flying colours.
The support was overwhelming, and the support during COVID, the extra shifts that people picked up, has been absolutely unbelievable to see just how supportive and how close-knit the whole community of Rosebud is.
2020 was a massive year for IT, having to enable people to work remotely, provided plenty of challenges for us, but we overcome them. And it was a really exciting year in all, being able to do that for everyone.
We did become a little bit more quiet in surgery, but the staff in our area really adapted to the change, gave us an opportunity to upskill, and staff were redeployed to other areas, which was really fantastic to see. I learned that we each went above and beyond to help each other at site at a very difficult stage of the year, and it actually brought the whole site together as a team.
We prioritize things that what need to be done, as in once we got a positive patient, we need to infect that room and close that room, and we did all the cleaning, as drop off everything and just focus on what needs to be done, and then we just jumped on and helped it up with each other as a teamwork.
The team have been great and developed great resilience, and have been really adaptive to changes in circumstances in patients, in the sort of patients that we're seeing in rehab, where we're treating them, we're treating more people at home and in the community.
2020 is one of the worst years that ever existed. We feel we've let the hospital down. A lot of my pink ladies are ringing me up every other day wanting to get back into the hospital because part of their life is giving money back to the hospital. And they love meeting all our customers and our patients.
As a consumer representative and a volunteer with Peninsula Health, I think I can speak on behalf of both sections by saying how much we miss our role with Peninsula Health, and we can't wait to get back to it. It is a very important part of our lives.
So we have learned a lot during 2020. Although it's been an incredibly difficult year with the pandemic, we have got many systems and processes in place to ensure that we are fit ready for any further outbreaks or any further escalations that we may see in 2021. Fingers crossed that, of course, won't happen. One of the big changes, and I'm sure many of you out there might have had this experience, has been the use of telehealth. Telehealth doing consultations through outpatients and follow-up with surgery care, and also doing some of our hospital and the home care through telehealth has been incredibly successful. It hasn't worked for all patients and clients, but it is something that we're going to continue to offer over the coming years. I'd also like to say that the use of technology and how all of us have been able to pick up and run with this new media on how we meet now, on how we provide care, has been an extraordinary change that has been taken on incredibly well by all our staff and community. It has been hard during the pandemic with our visiting restrictions and how we've had to try and manage the number of people coming into and out of the organisation. We have based all of that thinking around how we can ensure that we've got safe environments for both our staff, our patients and our visitors. I know it's been incredibly challenging and it's been very difficult for all of us to try and ensure that we can have access and give access to our patients, to their relatives. And I know it's been so hard for many of you. We are continuing to work with the use of technology. We are ensuring that we've got safe environments for everybody if in case we end up having any more COVID positive patients in the organisation. Even though everything was going on with the pandemic, we were still able as an organisation to deliver on a number of key strategies that we have been working on. The first thing that we were able to do is launch our new strategic plan, which details how we'll expand our research profiles and capabilities over the coming 5 years. We also launched our reconciliation action plan, which has been a fantastic piece of work which has been undertaken by our community advisory groups, our Aboriginal and Torres Strait Islander stakeholders and communities across the peninsula. We continue to invest in the safety of our staff with the development of a Youth First People and Culture initiative to help reduce our workplace injuries, particularly important in the environment that we've had over the past 12 months. And the mental health and wellbeing of our people remain a core focus. And we were named as the lead health service for a statewide wellbeing program called Thriving in Health. Of course, many of you look at our social media, and I think you might recall last year I talked about our new employee, the Director of Happiness, who happens to have 4 legs, and his name's Kenzo. He's our workplace wellbeing dog, and even though he wasn't in the organisation often during the last 12 months, when he was allowed to come in to the organisation when restrictions were reduced, he was fondly received by our staff. And we plan to continue our Dogs for Docs program over the coming year. We completed the feasibility study for the Rosebud Hospital redevelopment, with colleagues from the Victorian Health and Human Services Building Authority, and we navigated our ways through the expression of interest stage of the Frankston Hospital redevelopment, both very big pieces of work, and we also were able to start the Academic and Research Centre, and we had the celebration of the sod turn, which we're all really excited about actually getting this project up and running with our partners, Monash University. So that's going to be very exciting. We're hoping that the academic centre should be complete this time next year. We should be in it and working from it, which is going to be great. And also we're hoping that the expression of interest or the request for tender should be completed this time next year, and we'll be able to announce who the consortia are who are going to be building the new Frankston hospital. We also commenced and fully developed the National Centre for Healthy Ageing. So this was a Commonwealth funded project where we received $32 million over 5 years to research and develop models of care to support older people in our communities, but also to do research for all people on strategies of ageing well. So that work has also commenced. And I think I mentioned previously that we were able to install a new MRI scan, and that kind of happened in March, April, May last year. So it was a difficult time when we had the hospital closed down, but the building team were able to maintain COVID-safe practices and were able to get that new MRI machine in for us to start using in the middle of the year. So we continue planning the Rosebud Hospital redevelopment. We're going to start the business case for the Rosebud Hospital this year, and we've also completed a business case for the redevelopment of the Mornington Centre, and that's to the plan is to bring back onto that site our community health service, which is sitting in Tantai Avenue. It's also looking at bringing up our mental health program for Mornington, which currently resides down at Rosebud Hospital. So we want to get them back up to the community that they serve. And we're also looking at our psychogeriatric services being brought back onto that site. You might have read that the government are committing a significant amount of money to increasing the number of people that we can care for in the home through a Better at Home initiative. We are very keen to increase the number of people that we can offer hospital in the home to, and to further develop our residential aged care in-reach programs. So that will be a key initiative that we will implement over the coming 12 months. And I thought we might have the final report and recommendations of the Victorian Mental Health Royal Commission and the Commonwealth's Royal Commission into Aged Care and Quality and Safety. We haven't yet received those reports, but I keenly await to read those recommendations, and I'm sure they will be an interest to all of you. We will shortly launch our digital health strategy, the Peninsula Health Digital Health Strategy. It was developed over the past 12 months and will set the agenda for our digital health investments over the next 5 years. And I think that has certainly evolved with all the lessons learned during the past 12 months. So a very exciting time looking forward in the next over the next year, but also an incredible time for all our staff and community was 2020. And I think our staff have been incredibly grateful to the tremendous support that we've had from all our community. I will note that our volunteers have had to spend the majority of their time outside the organisation this year. I know that's been difficult for them. They've been busting to get back into the organisation. Again, we need to wait until we can ensure that we can operate in a safe environment. we too would like all our volunteers back, but we have been keeping connected with them through technology. We've been still running our community advisory committees through our Zoom platform, and we still feel very connected to all our volunteers. Before I finish, I would like to take this opportunity to thank our chair, Diana Heggie, and all our board directors for their truly valuable contributions that they've offered during the past 12 months. It's been difficult for them. We've had to run all our board meetings using the virtual platform, but they have been very much by our side while we've had to deal through the pandemic, and have been a great support and guidance to me. And finally, I'd like to thank each and every person who works with me here at Peninsula Health. Like I said, all our staff who have just been amazing, and I cannot be more proud of the people that work here at Peninsula Health. I'd now like to hand back to Diana for the Life Governor Awards. Thanks very much.
Thank you, Felicity. I now have the great privilege to honour the 2020 Life Governors. These special awards recognise those individuals who have provided 10 years of voluntary service to Peninsula Health, a fitting acknowledgement for our wonderful volunteers. This year we have 19 awardees. To our 2020 Life Governors, your service is greatly appreciated by members of the board and by the staff here at Peninsula Health. And it is with pleasure that we recognise your efforts with everyone who is online for our AGM today. As we are meeting online, we cannot complete our normal formalities, but instead, I am delighted to say that our volunteer and communications teams have been able to create this great slideshow so that we can say thank you in a very modern online way. That concludes the list of the 2020 Life Governors. We are so fortunate that these wonderful people live and work in our community. My sincere congratulations to everyone honoured with the Life Governorship of Peninsula Health today. I will now hand over to our CEO, Felicity Top, for the Community Forum.
Thanks, Diana. I'm hoping everybody can hear me well. And I'd like to also congratulate all the Life Governors for their fantastic support over many years. So this is the fun part of the AGM. This is when I get an opportunity to talk to our community and answer questions. And it's a little bit different this year because I'm needing you to write your questions in on the question and answer box. So I will just wait and see if I have any questions coming through. I'm sure there are some people out there who have something to ask me. Do I have any questions? Okay, I think there's a couple coming in here now. Hi there. I've seen some works happening at Frankston Hospital, just wondering what's been built. Well, there's been a fair bit of work at the front of the hospital. You'll notice that one part of the area has had a number of tents constructed out the front on the tennis courts. Those marquees have been used to run our mobile screening service for the community. And we've also started our academic centre. So that's what the majority of the work's been over the last couple of weeks. And like I said, the academic centre is a partnership with Monash University, and we are hoping to be in there sometime next year. I'm just seeing if there's other questions coming through. Please ask questions. Thanks, Ginevra, for your comment there from the Committee of Greater Frankston. I'm just seeing if there's any other questions. I am hoping that everybody managed the 5-day lockdown that we had last week. I must say our staff were terrific, and so were all our visitors and consumers who understood the need for us to reinstitute some visiting restrictions. So that was fantastic. I've got another question from someone. How are your staff going after 2020 and then another lockdown? Good question. As I said previously, it's been a really tough year for our staff. A lot of staff have been incredible. All the staff have been incredible during the last 12 months, and a lot of people are tired. So we worked really hard on trying to get people off on leave over the summer. I think the 5 days that we've just had, I think kind of shocked everybody a little bit, but our staff responded really well. Very quickly, people were able to return back to working from home. We changed some of our PPE requirements, and that went seamlessly. And our people who are staffing our testing sites did a great job. We ran some extended hours to make sure that we had plenty of testing capability for our community members. So I think that was great. I've got a question here from Barry Nichols wondering about the Peninsula Health as a hub for a vaccine rollout. What I might do, Barry, is ask Shimon Mannon, who is our Executive Director of Medical Services, to jump on. Shimon, are you there? There he is. Pop your camera on. Shimon, I might get you to just let the community know what the vaccination plans are for Peninsula Health.
Yep, so the vaccination plan will be guided by the guidance by the Australian Department of Health, the Australian Government Department of Health. At Peninsula Health, we are going to be starting off currently by doing our staff who go into what they are classifying as phase 1A. That is our frontline worker staff, and we are developing processes very much in collaboration with our partners at Monash and Alfred Health to build a program. At this stage, we haven't been given guidance in terms of what we would be providing for the public, but as soon as that information becomes available, we'll send that information out. Okay,
thanks, Shimon. And hopefully that answered your question, Barry. And thanks for joining too. It's great to see you online. I've also had a question regarding a little bit more information for the plans for Rosebud Hospital. I think I've spoken to many of you previously that we have done our working through the process of getting a business case ready for the redevelopment of Rosebud Hospital. We were planning to do the business case last year, but of course other things took precedent with the pandemic. So we are starting the business case this year for government consideration to do a rebuild of Rosebud Hospital. So I think that'll be an exciting time, and certainly I've had a number of community forums back in, gosh, I think it was 2019 now, seems like a long time ago, town hall meetings with community members. So as we get that business case going, we might also run some more town hall meetings to keep everybody up to date. I've also got a comment here about the number of learners that we had in the organisation. Yes, look, thanks for that reminder. It was a very difficult time for all our students who were trying to get their clinical practice, and all our graduate doctors and graduate nurses and graduate allied health members. And they did a remarkable job. Could you imagine starting your graduate year during 2020? I mean, I can remember my graduate year, and there's no way I had to deal with the pandemic. And I've spoken to a number of those graduates, and they kind of embrace the teamwork and embrace the challenge. So yes, I do want to thank all of them. They really did do a great job. What were some of the key lessons you learned from the COVID-19 pandemic? Gosh, I don't think we've got enough time to talk through all the lessons I learned and we learned. But as an organisation, I think a lot of the lessons we've learned have been the lessons that everybody else has learned during the pandemic. Certainly how important the environment is, and how you need to set up the environment well to care for people who are COVID positive. Making sure that you've got adequate circulation space around patients, making sure patients are in a room by themselves. Tea rooms were a big issue for us here, which is the reason why we've got Tent City out there, so we can separate staff out from wards so they can have their breaks in tea rooms. Communication, and I still don't think we communicated enough. We tried to communicate with everybody about what was happening here, both staff, volunteers and our community. Trying to get those messages out to everybody in such a rapid changing environment was incredibly difficult. Testing and tracing, kind of not a completely new activity for our infection prevention and control team, but the number of testing and traces that we needed to have was quite significant. And the amount of training that we had to do for 6,500 staff members on properly managing PPE was quite a challenge, but incredibly important and fantastic that our staff were able and participated so well in managing their PPE. I cannot overstate how difficult this virus is to stay ahead of. And I think the community is also getting more and more knowledgeable and expert about the COVID-19 virus. I'm very pleased that we've got the vaccines coming online. That doesn't mean we cannot remain vigilant. We absolutely have to remain vigilant. And while I've got everybody's attention, please, if you have any symptoms at all, please get tested. Please isolate until you get your results. And hopefully by the end of the year, we'll have this virus conquered. I'm just checking out those questions. Thanks, David, for your comment. It's great that you're able to come online, and thanks again for all of Monash University's support over the year. And I think I talked about the National Centre for Healthy Ageing. National Centre for Healthy Ageing is absolutely a collaboration between Peninsula Health and Monash University, and there is some great work happening there. Not too sure if I've got any more questions. Has the COVID experience had an impact on how the design of the new Frankston Hospital redevelopment? We've certainly taken on board a lot of the lessons that we've learnt with regard to airflow and ventilation. We've got a significant number of additional private rooms being developed in the new hospital, so that's going to be fantastic. And also the whole airflow and air systems, I am sure, will be compliant and increased as a result of some of the changes being implemented through government. So yes, there will be significant changes, I suspect, in the design that we see in the new hospital. I don't think I've got any other questions coming through. So if I don't have any other questions, can I just again say thank you for everybody for participating this morning. Like I said, it's been an incredibly challenging year for Peninsula Health, but also a fulfilling year for all of us, both in managing the pandemic, but also being able to achieve a lot of other key initiatives during the year. I might hand back to Diana now, if there's no further questions, to close the AGM. And once again, thank you to all our staff, volunteers, and our community members. Thanks.
And thank you all for taking the time to join us online today and for giving us your valuable insights and feedback. It has been fascinating to hear your thoughts and ideas on how we can continue to make Peninsula Health even better at providing safe, personal, effective and connected care for every person, every time. There are exciting and possibly challenging times ahead for us all, and I look forward to continuing to work with you all over the coming years. It is now my great pleasure to close this year's annual general meeting with a wonderful song of hope, resilience, and unity from Kutcha Edwards. Kutcha originally performed the song for us at the launch of our Reconciliation Action Plan in December, and we are delighted to be able to share it with you now.
G'day everybody down there at Peninsula Health, down on Mornington Peninsula there. Kutcha Edwards, Daniel J. Marquez. Just want to congratulate everybody there at Peninsula Health on your 2-year RAP, Reconciliation Action Plan. And good on yous. All non-Aboriginal organisations need to be heading in that direction and working towards reconciliation in all facets, not only in health. But good on yous. Good on you, Helen. Good on you, all the Aboriginal workers and the mob down that way, and all the non-Aboriginal workers within Peninsula Health. Good on yous. See yous in 2021. This is a song called Get Back Up Again. When you're sick and you're crook, doesn't matter. Get back up, get moving, and you'll end up a bit more healthier than before. See yous in the new year. Toodaloo. Get back up again, Daniel, son. Just so many times I've had to stand and fight. So many times I've been told it'll be alright. Don't matter if you get knocked down and suffer so much pain. As long as you can find the strength to get back up again. As long as you can find the strength to get back up again. It is better to have tried and failed than never tried at all. But when that battle sounds, we'll all answer to the call. Hey Dennis, so many years in a drought without rain. We might must come together to get back up again. I said we must come together to get back up again. I will bear my soul. I will bear my There's so many times you can go to the well. Just so many lies all those politicians can tell. I will bear my soul. I've got much more to gain. You can knock me off my feet. I will get back up again. I said you can knock me off my feet. I will get back up again. I will bear my soul. I will bear my Get back, get back, get back, get back, get back. Get back, get back, get back, get back, get back. Get back up again. Get back up again. Get back up again. Get back up again.
Thank you all again for your attendance at our online annual general meeting today. Thank you.